Okay, looks like we have a good number of folks in the room, so we'll go ahead and get started, and others can join us as they join the room. Want to wish you a good afternoon and welcome to our session today. This is for 2025 Open Enrollment Benefits session. My name is Rachel Allen. I am part of the HR Learning and Development team. I'm going to serve as your moderator for today's session. And again, we want to thank you for being here today. We've got a wonderful presentation for this afternoon. You're going to get a lot of great information from our facilitator, who is Deborah Ledbetter. She is from the benefits team making our presentation today. And then also from the benefits team, Kathleen Michael will be monitoring the Q&A chat. So a couple things to know, as we go through the presentation, please put any questions that you have in the Q&A window. It's a small box at the bottom of your screen. We are going to use that for all questions. So please put any questions you have in the Q&A window. Kathleen Michael is going to be monitoring that chat as Deborah presents, and we're also going to have a couple of breaks for Q&A as well. I'm going to be sharing some relevant links in our chat, the regular chat, throughout the session to support what Deborah is talking about. In regard to your questions, just a quick reminder, we ask that you try to keep your questions broad and relevant to all attendees. In general, if you have a question, someone else probably has the same question, so go ahead and put those in that Q&A box. If you have something more specific or personal, feel free to email askhr@virginia.edu and request a one-on-one session with a benefits counselor. Other than that, I think we're ready to go. Deborah, over to you.
All right. Thank you so much, Rachel. I appreciate that. So everyone, thank you so much for joining us today. Welcome to our presentation for open enrollment. This is for plan year 2025. So open enrollment begins October 7th and will last through October 18th. And any changes that you make during this time are going to take effect on January 1st, 2025. So we're really excited to announce that we do have some new online resources for this year. We have some new quick videos that address some key topics regarding your benefits. So these are going to include saving for retirement, getting help with a claim, changing your benefits, enrolling in benefits as a new hire, and then information on what a high deductible health plan is in conjunction with a health savings account. So we encourage you to take advantage of those resources. So this year's theme for open enrollment is healthy and connected community. And so let's talk about what do you need to do during open enrollment. So the first thing you're going to do is review what your current benefit options are, or what you currently have, what your elections are, and then the options available to you. So you want to take a look at health plan options, HSA, healthcare FSA, dependent care FSA, look at your supplemental retirement savings plans, and then take a look at how you used healthcare this year and possibly even the prior year to determine what the best options are for you going into 2025 based on your past usage. So if you're going to be adding dependents to your insurance, you're going to need to submit documentation to show that that dependent is eligible. So for example, submitting a birth certificate for a child. So we encourage you to have these documents ready before you start the enrollment event, because you're going to need to upload those before you can submit that. So be sure to have those documents ready before you start your open enrollment. So you're going to make your elections through Workday, and you're going to elect what you want during open enrollment. And then if you don't do anything, your current benefits are going to roll over into the next year, with the exception of FSAs. So if you have a healthcare FSA, a dependent care FSA, or a limited FSA, you do need to re-elect those for 2025. Those do not roll over into the new year. We now offer a employee primary care clinic. So we know that sometimes it can be challenging finding a primary care physician, a PCP. So now UVA is offering a employee primary clinic for those that are employees that are covered under the UVA health plan. And you can even get same-day care through this clinic. So you can access this and make an appointment through your MyChart account, or you can call this telephone number. And I did also want to point out that on a number of these slides, there are QR codes that you can scan in order to get more information on what we're discussing on each slide. So this employee primary care clinic is located in the West Complex. You can see the exact location here. And do note that this currently is available to employees, not currently to spouses or dependents. So employees only currently. Another benefit that we wanted to point out this year is that there are a number of choices when it comes to mental health resources. So under the UVA Health Plan, you can access mental health services through a number of different avenues, both in person and virtual. And so you can take a look at Talkspace, you can take a look at Ray at Home, Teladoc, and Brightline. So a number of different options to meet your needs. And do make note that any mental health services are subject to deductible and coinsurance like other health services under your plan. So there are 3 health plan options under the UVA Health Plan, and we did want to mention that all 3 plans are remaining the same for 2025. So the deductible, the copays, coinsurances are not changing. So those will remain the same. However, what is changing is 2 of the plan names are changing for 2025 because we wanted to highlight key features of those plans. So, for example, if you are covered under the basic plan, that plan name is going to change to Health Savings. The plan itself will remain the same. The name is going to change to Health Savings because we wanted to point out that key feature of the Health Savings account. The value plan is going to be referred to as the UVA PPO. And then the choice plan will remain the same. Again, the names are changing, the plan themselves are not. So under all 3 options, there are all 3 plans cover the same thing. So the out-of-pocket maximum is the same for all 3 plans. It's $5,500 for an individual, $11,000 for the employee and any covered dependents. That's the same for all 3 options. That out-of-pocket maximum is the maximum that you're going to pay in the plan year. After you meet that maximum, then the plan pays 100% of covered services. So preventive care under all 3 plans is covered at 100% with an in-network provider. And so, for example, getting your annual routine physical covered at 100% if you go to an in-network primary care physician. Preventive well child care for children up to age 7 or under age 7. Again, in-network provider, primary care covered at 100%. Screenings, screening mammograms, screening colonoscopy, routine preventive or prenatal maternity visits are also covered. And so deductible and coinsurance are going to apply to all non-preventive services. And all of these are the same under all 3 plans. Our health plan is with Aetna. So Aetna is the administrator for all 3 of those plans. So let's talk about those 3 plans. So the first plan is the Health Savings option. And again, right now it's referred to as basic. It's going to be called the Health Savings option. Under this plan, this is a high deductible plan. And under this plan, the deductible is $2,000 for employee only coverage and $4,000 for employee and dependents. And under this plan, after you've met that deductible, you'll have a coinsurance of 20%. So prescription coverage under this plan is also subject to that deductible, except for if the medication is on the preventive medication list. So with the health savings option, it is offered with a health savings account or HSA. And so you need to be eligible for enrollment in the HSA in order to elect the health savings option. So let's talk about that health savings account eligibility. So again, this is available. The HSA is available to employees who elect the health savings option. And if you are covered under TRICARE, Medicare, or Medicaid, you would not be eligible for the HSA. And you and your spouse cannot have a full FSA in the same year. So what is an HSA? So it allows you to save tax-free money out of your paycheck for qualified health expenses. So these funds are pulled from your paycheck, put into your HSA, and then you can use that for qualified health expenses. You're going to receive a card, which is just like a debit or credit card, and that's what you would use at the point of service to pay for those charges. So these funds do roll over year after year, and they're yours to keep. And you can contribute up to, or contributions can be made up to the IRS maximum. So the IRS maximum for 2025 is $4,300 for the individual or $8,550 for family. And you do have to take into account the UVA contribution. So UVA provides you what's called seed funds. And if it's employee only coverage, UVA provides you $1,000. And then if it's family, it's $1,500. So when you're taking a look at how much you can contribute for the year, let's say, for example, that you are employee only, then you would take the 4,300 minus the $1,000 UVA contribution, and that would be the limit that you would contribute for the year. Do note that if you are age 55 and above, you are able to contribute an additional $1,000. So one thing I do want to point out is this last bullet point here at the bottom of the slide where it says accounts must be opened within 90 days or the employer contribution is forfeited. So let's talk about that. This applies to individuals who are newly enrolling in the HSA. So if you have the HSA now, this does not apply to you. This is for new people coming into the HSA for 2025. So what happens is, we take those employer funds, we send them over to Fidelity, who is the vendor. If Fidelity needs additional information from you in order to open that account, they're going to reach out to you by email and by mail. So check your email, check your mail, see if there's additional information that's necessary. If you do not respond to Fidelity within 90 days and provide that information that's needed to open your account, the account will not be opened and that employer contribution is going to be forfeited. So the key piece of information here is please take a look at your email, look for information from Fidelity. You may or may not, if they're able to open it, they will, but if they need additional information, they're going to reach out to you. So please make sure that you're looking out for those emails, and if information is needed, do so within 90 days. So one really good piece of information is at the bottom of the screen. So for 2025, if you are currently in an HSA and making contributions, that election will carry over into the new year. So you don't have to re-elect HSA for 2025. So that's a nice thing. And again, just a reminder that you can change your HSA contribution at any time during the year. The second option is the UVA PPO option, currently referred to as the value plan. So under this plan, there is an $800 individual deductible and $1,600 for the family. And under this plan, the coinsurance is 20% after the deductible has been met. Now, this plan is the only plan that has copays for office visits. So the copay is a $40 copay for primary care physician, not subject to that deductible. And it's $80 for specialist, again, not subject to the deductible. And if you use UVA providers, it's a little bit of a discounted rate, so $25 for the PCP or $50 for the specialist. Now, prescription coverage is tiered coverage. So what that means is if it's a generic prescription, you're going to have a flat dollar copay in cost, and that's not subject to the deductible. If it's not generic, it is going to be subject to deductible and coinsurance, except for if it's listed on either the chronic medication list or the preventive medication list. The third option that we have is the choice health option, and this name will remain the same in 2025. Under this plan, the deductible is $500 for the individual and $1,000 for the family. Under this plan, the coinsurance is 15% after the deductible has been met. And the prescription coverage, again, if it's generic, it is a flat dollar copay. If it's non-generic, then it'll be subject to deductible and coinsurance, except if it's on the chronic or preventive medication list. We do want to point out that the Choice Health Plan will be closed to new enrollees starting January 1st of 2026. This is a action that we're taking in order to allow an opportunity for other options in the future. So here is the premium chart. This is monthly premiums for 2025, and the amount that's in orange reflects the amount of the increase. So for example, under the health savings plan for employees that are currently covered under what's now referred to as basic, employees are paying $30 a month. In 2025, they're going to pay $36 a month for employee-only coverage. If you, of course, add dependents, those rates do go up. The UVA PPO plan, now referred to as the value plan, if you have employee-only coverage, you can see that the monthly rate will go up to $101.25. And of course, adding dependents, those rates will increase. If you are paid biweekly, you want to divide these by 2 in order to get the per paycheck cost. And again, we just want to remind you that there's no changes to any copays, coinsurance, or deductible. The plans themselves are exactly the same. There is just an increase in the premium. And for certain employees that are covered under, for example, J-Visa employees or house staff, the premiums are different. So if you fall into one of those employee groups at the bottom of the slide, you'll want to take a look at the website for premiums for your coverage. We have this slide. It's called Health Plan Options at a Glance. And we think this is a really great way to take a look at the total financial picture for each of the options. So when you're evaluating your health plan options, you want to take into account not only what you pay when you receive services, but what's coming out of your paycheck as well. So if you're looking at the screen, so the annual premiums are in orange. So this is going to show you how much you are going to pay in 2025 for that plan. That's coming out of your paycheck. That is a fixed cost coming out of your paycheck, whether or not you ever go get services. These are fixed costs, right? That amount in orange. Then the next item that's listed is the deductible. So that's how much you're going to pay out of your pocket before the plan pays for services, right? And then that $5,500 is that out-of-pocket maximum. So this is showing the worst case scenario, meaning that you've got a lot of services in the year and you reach your out-of-pocket maximum. This is showing you what your total cost is going to be for employee only in 2025. So you'll notice that, for example, under the health savings, you're going to pay $432 out of premium. You're going to have a $2,000 deductible. And then if you were to reach your out-of-pocket maximum and you include that $1,000 seed money from UVA, your total cost is going to be $49.32 for 2025. You'll notice that under the UVA PPO and the choice, there is not that negative number, because under those plans, you don't have access to the health savings account where the UVA is providing that seed money. So those costs are, showing as higher because you're paying a higher premium for those and you're not getting that UVA seed money. So we think this is a helpful chart just to kind of see the overall financial picture. And again, when you're looking at health plan options, you really should evaluate all of those aspects. So before we go to the dental plan, Kathleen, are there any questions relevant to the group?
Let me see. We've had a lot of questions rolling in.
Okay.
Someone is asking how it works in terms of the deductible when you have more than one person on the plan. In other words, can you meet your deductible? Can one person meet the deductible, or does the whole family have to meet it?
That's a great question. So it's going to depend on the plan. So let's work through that. So under the health savings option, which is that high deductible option, you've got an individual deductible of $2,000, meaning that if it's just you covered, that's that $2,000 deductible. Now, if you add any dependents, whether it's 1 or 5, you've got a family deductible of $4,000. It means that that $4,000 has to be met for the year, whether it's met by one person or multiple people, that entire 4,000 has to be met before the plan starts to pay charges. Now, if you're looking at the UVA PPO plan or the choice plan, it works a little differently. So for example, under the value plan, you have an $800 deductible per individual and then $1,600 for family. So here's how it works. Let's say that it's you and 2 other dependents covered. So if you meet your $800, then the plan pays, starts paying for services, right? If a dependent meets, let's say, $400, then you still are having those charges. The plan is starting to pay, but for those other dependents, it's not. So that additional $800 to meet that $1,600 would have to be met by those other individuals in order for their services to start being covered by the plan. So again, under the health savings plan, you do have a true $4,000 deductible before the plan pays for anything, for anybody. And then under UVA PPO or the choice plan, it is truly an individual deductible. So if one person meets the 800, then the plan starts paying, and then the other individuals would need to either meet the 800 individually or in a combination.
Thank you. Someone is asking if this is the last opportunity to opt into the choice plan.
It is. So during this open enrollment period, if you want to opt into the choice plan, you can. And we certainly can, if you wanted to sign up for a one-on-one appointment, take a look at your current coverage compared to the what the coverage would look like if you chose the choice plan. We would encourage you to do that. We want to make sure that you're making a good decision if you choose, the choice plan versus something else.
And also, if you're in the choice plan this year and you wanted to continue it into next year, you will be able to do that.
Yes, you certainly can.
In 2025 into 2026 is what I meant to say.
Yes. So the 2026 is going to be, that time frame is going to be closing it to new employees. So you would not be able to elect it any new, but it would carry over from that point. Again, I think we would recommend, this is a great time to really reevaluate participation in any plan that you have, to take into account, how you've used it and whether or not it continues to be the best plan for you and your needs. We just, again, want to remind you that all 3 plans cover the exact same thing. So, having one plan over the other isn't going to change as far as what's covered. The differences are going to be in how you pay. Pay more now, pay more later, whether or not you get the benefit of the UVA seed money if you're participating in the health savings plan. So, there's a lot of things to consider when you're looking at these as far as what's the best plan for you. So we're going to talk about the dental plan. So this is an entirely separate plan. You can have just medical, not have dental. You can have dental, not medical. You've got some flexibility there. This is through United Concordia, and we have 2 options available. We have a basic plan and an enhanced plan. So under both of these plans, they do cover in-network preventive care at 100%. And there is a deductible of $50 a year that applies to non-preventive services. So there are 3 key differences between these 2 plans. The first is orthodontia care. So orthodontia braces. So with orthodontia, enhanced covers it. The basic plan does not. So if you or one of your family members needs braces, you want to definitely consider the enhanced plan because it covers that. Basic does not. So under the orthodontia care, you pay 50%, the plan pays 50%. There is a lifetime maximum benefit, meaning the maximum amount that the insurance company will pay, and that's $1,000 per person. The other difference between the 2 is the annual maximum benefit. Under the basic plan, it's $1,000. Under enhanced, it's $2,000. So what this means is how much the insurance company is going to pay for you in 1 year, right? So if you are, if you get your cleanings and your x-rays, twice a year, right? Every 6 months. And that's typically what you do, you might have a filling, then you're probably not going to reach more than $1,000 in benefit. So the basic plan may be sufficient for you. If you have usually get a lot of dental work done, you may want to consider the enhanced plan because you're going to get up to $2,000 in benefit. Under major restorative work, another difference is under the basic plan, you're going to pay 50%. The plan pays 50%. Under the enhanced plan, your costs are a little bit lower at 40%, and the plan pays 60%. So a couple of key differences to think about when you're choosing your dental plan for 2025. So this is going to show you the monthly premium rates. Again, you would divide these by 2 if you're paid bi-weekly. If you select the basic plan, it's $1 per month for employee only. If it's enhanced, you're paying $10.50 a month. And of course, if you add family members, those rates do go up. Do note that these rates are not changing. So what you're paying now is what you're going to pay in 2025. So that's good news, no increase in premium. Of course, if you fall in other employee categories, such as a postdoctoral fellow or house staff, so forth, your rates would be different. This slide does show vision premiums, but I'm going to go ahead and skip before we talk about that. And let's cover vision. So if you are enrolled in the UVA health plan, you do have an embedded vision benefit. It's a discount program through Aetna. And this is going to give you discounts on your eye exam, on eyewear, that sort of thing. So that's all part of your UVA health plan at no additional cost. We also offer a separate vision product through Davis Vision. And this is an insured plan that provides you coverage for your annual eye exam. You get allowances for frames and lenses or contacts, or you can get discounts on additional products and certain features of glasses and so forth. So one thing to note is that if you do elect Davis Vision and you're covered under the medical plan, meaning that you have both, both of these things cannot be combined in one visit. So, if you're thinking about Davis Vision, whether or not you would need that, one of the things you might want to think about is, let's say that you wear disposable contact lenses. You might want to get the Davis Vision because it's going to give you a $130 allowance towards that. And let's say that same year you need new glasses. So that would probably, be something to think about because you can purchase your glasses, get a discount under your Aetna Vision, and then use your Davis Vision to get your contact lens allowance. So just something to think about based on your needs. So let's go back to that slide to talk about vision premiums. Again, good news is that there's no change in that. For employee-only coverage, you're looking at $8.32 a month. And of course, if you add family members, those rates go up. Okay, so we'll take just a brief break. Were there any questions, Kathleen, that would be for the group for dental or vision?
This kind of goes back to health, actually, but someone is asking about spousal eligibility. So maybe this would be a good time to review spousal eligibility for the health plan.
That's a great question. Okay, so under the UVA health plan, if your spouse has access to coverage under their employer that meets affordability and minimum value, most employer plans do, but we do have a calculator for that. But basically, if they're offered employer coverage, then your spouse would not be eligible to be covered under the health plan here at UVA. So this does not apply to dental and vision. So even if your spouse has access to employer coverage for dental and vision, they could still be covered here under UVA. But on the UVA health plan, again, if your spouse has access to employer coverage, they would not be eligible to be covered under the UVA health plan. I would suggest if you have questions about your particular situation, definitely send an email to askhr@virginia.edu and let us take a look at that for you.
Thank you. Someone's asking if I just need a vision test and nothing else, which plan would be the best?
Well, if you're going to enroll in the health plan anyway, then you're probably going to be just fine with the discounted program because it does provide a discounted eye exam, and you would get, that discounted rate. So you do have coverage for the eye exam, and then you're going to get discounts on eyewear. So if you do find that you need some glasses, you would get discounts on that. If you are not choosing medical, then of course, go ahead and enroll in Davis Vision so you can get your eye exam covered. But if that's all you're going to do, you probably don't need Davis Vision.
In addition, someone's asking about the Aetna discount program and whether they receive a card. That's just going to be your regular Aetna health insurance card because it's not a separate insurance. It's just a discount for people who are already enrolled in the Aetna health plan. Sorry, I answered that for you.
No, thank you. Thank you very much.
And someone is asking, is this Aetna Vision discount a new benefit?
No, it is existing.
Does dental plan cover Invisalign? The answer is yes to that.
Yes.
Keep in mind, you do have that maximum amount that they will pay you, which is a lifetime benefit. Someone is asking whether our rates, when they say employee plus child, does it include more than one child? Is the rate the same if you have one versus multiple children?
Yeah, that's a great question. And the answer is yes. So the employee and child or children rate covers one child or 10 children, regardless of the number of children that you cover, it'd be the same rate.
And then someone's asking if both spouses work at UVA, can they have separate medical, dental, and vision, or do they need to be together?
It's up to you how you want to do it. So the employee can only be covered under one plan. There can't be duplicate coverage, but you can choose if you say, hey, I want to, be covered under my UVA spouse for dental and have my own medical, you can certainly do that. So it's really up to you how you want to do that.
And then Rachel, if you could put the phone number for Davis Vision in the chat, someone is asking who the contact is for that. So we will provide that for you. And someone is asking if there's a side-by-side comparison of the Aetna insurance and Davis Vision discount. We don't have a side, sorry, go ahead.
Oh, no, go ahead.
There's no side-by-side comparison, but we do have a summary of each one, and it's just a one-pager for each of them. So we can put the links to that in on the chat or Q&A here. You can go on our website and see what each of those cover. Remember that the Aetna is just a discount, it's not insurance.
Great questions. Thank you. Okay, so next we're going to talk about the FSA, or flexible spending account. And so this is a healthcare savings, a savings account for healthcare expenses for those who are enrolled in the UVA PPO or choice plan. So under this plan, the full healthcare FSA, you can, well, let me back up for just a moment. So for the full healthcare FSA, this is for people who are under the UVA PPO and choice plan. If you're under the health savings plan, remember you have the health savings account, or HSA, you can also elect a limited FSA for dental and vision only. So you do not have to be on a UVA health plan in order to elect an FSA. One thing you do need to note, though, is that you and your spouse cannot have a full FSA and an HSA in the same year. So the FSA allows you to save pre-tax dollars through payroll deduction to pay for eligible medical, dental, prescription, and vision expenses for the calendar year, and through a grace period of March 15th of the next year. So you can elect up to $2,500 in the FSA per year, and that full balance is available to you up front. So just a reminder, just going back again, if you're in the UVA PPO or choice plan, you can do a full FSA for all eligible medical, dental, vision, prescription expenses. If you're in the health savings account or a health savings plan, you have that HSA, and you can do a limited FSA for just dental and vision expenses. Now, one thing I do want to point out is that last bullet point at the bottom of the slide where it says use or lose. So you want to make sure that you use any of the funds that you have by the grace period, or you do forfeit them. So if you do choose the UVA PPO or the choice plan, and you decide to elect the full FSA, be very, very careful about how much you elect to contribute, because if you don't use all of those funds, then you do forfeit them. If you choose the health savings option and you want the limited FSA for those dental and vision expenses, again, be very careful about how much you elect to contribute, because if you don't use those expenses, then you do forfeit them. One thing I do want to point out is there is an online FSA store. So if you find that you're getting close to that grace period and you have some funds available, you can use those funds through the FSA store. So you might want to take a look at that. We also have a dependent care FSA. So this is for all benefited employees. So even if you don't participate in the UVA health plan, you can elect the dependent care FSA. And this is to save pre-tax dollars to be used for eligible childcare for children up to age 13, or for adult dependents who are incapable of caring for themselves. So you can contribute up to $5,000 per year if you file your taxes jointly, $2,500 if you file single. The household limit is $5,000. The funds are available when they're in your account. So what that means is, they're going to be payroll deducted, placed into your account. That's when you're able to use those. And again, these do need to be used by the grace period, or they are forfeited. One thing I do want to point out is when you're making these elections for the FSA, please be very careful in electing the correct FSA. We have had employees elect the dependent care FSA by mistake, intending to elect the healthcare, but they did dependent care. And that's one of those things where you don't want to do that. You want to make sure that you are electing the proper FSA. So just take your time. When you're sitting down to do your benefit elections, look at it very carefully and make sure that you're electing the correct coverage that you intend. So when you elect the FSA, you're going to do that through your open enrollment event in Workday. And here's the thing, if you don't elect it, you do not have it in 2025. So let's say that you're currently using an FSA. If you don't elect that during open enrollment for 2025, you are not going to have your FSA for 2025. So please be sure that you go through the open enrollment event, make that election. And if you don't elect it during open enrollment, you won't have an opportunity to do so unless you have a qualified life event. So, now's a great time to make sure that you're taking a look at what you have, make sure that you're making the proper elections for 2025. And again, just a reminder that if your spouse is electing an HSA, then don't elect the full care FSA. So take a look at that and make sure that coordinates. We're going to switch gears a little bit. During open enrollment, you're able to make changes to your, medical, dental, vision, and health savings accounts. Open enrollment is really a good opportunity also to take a look at your retirement. So, of course, you are participating in a mandatory retirement program, but we wanted to remind you that you are also able to contribute to a supplemental retirement plan, either through a 403B and or a 457. So why is that important? Well, a couple of things is you want to make sure that you're saving enough for retirement. So, there's a contribution that you're making to your mandatory retirement account. This gives you an opportunity to put aside even more. And the really neat thing about this is both plans do offer both pre-tax and after-tax Roth contributions. So you can work with your financial advisor to determine your overall retirement strategy. You may want to do, some of both or a combination. to meet your retirement goals. You have access to that, which is a really neat feature of both plans. The other thing is you do get a cash match from UVA. So, if you're not participating in one of these plans, then you're really missing out on essentially free money, right? A match from UVA. So we encourage you to do that. So on this next slide is just kind of a really interesting example. So this just kind of shows how saving retirement and starting as soon as you could really pay off in the end. So here's an example of how if you were contributing $200 a month, right, over a 20-year period, and this is assuming a 6% interest rate, this is showing you how the amount that you invest would be around, 47,800. Simple earnings on that would equate to around 2,900. And then because of compound earnings, meaning that you're getting earnings not only on that $200, but earnings on the earnings, you're getting an additional, roughly $15,730. So I think it's a really interesting example of how making those additional contributions and allowing that earnings and those compound earnings to grow could result in a stronger retirement position when you're ready to retire. So let's talk about that match. So your match is going to be determined by your mandatory retirement program. So if, for example, you're in the VRS hybrid program, so you're making your 5% mandatory contribution, you would want to next contribute up to 4% voluntary contributions on top of that 5%, and you would get a 2.5% cash match. And so after that, so you're doing your 5% plus 4%, getting that match. After that, you can start contributing to the 403B. And if you're putting in at least $80 a month, you're getting a $40 match. So UVA in that 403B scenario, UVA matches 50% of what you put in. So if you're wanting to maximize that match, put in at least $80 a month, you're getting another $40 a month from UVA. So again, essentially free money from UVA. If you are a participant in the optional retirement plan, the VRS 1 and 2, or the medical center retirement plan 1, then you can contribute again to the 403B. UVA matches 50% of what you put in there, up to a maximum match of $40 a month if you're putting in at least $80 a month. Now, if you are a participant in the medical center retirement plan 2, then if you are contributing at least 4% of your pay, then you're getting a 2% match. Again, UVA matches 50% of what you put in there. If you're wanting to maximize that match, put in at least 4% to maximize that 2% match. We're going to talk about life insurance next. So all benefited employees do receive basic life insurance by UVA. And you can request additional life insurance, optional life insurance at any time during the year. This would be optional insurance on yourself, your spouse, and or children. Now, if you request this during the year, evidence of insurability is required, meaning that medical questionnaire, and that gets reviewed, and your coverage does need to be approved by the carrier. So there is an exception during open enrollment for ORP and MCRP participants. So this does not apply to VRS, just the ORP and MCRP. But during open enrollment, if you are currently covered under the optional life insurance and you have 1 times or 2 times your salary of coverage currently, you can increase that by 1 times your salary without providing that evidence of insurability or medical underwriting. So anything that exceeds 3 times salary would require the evidence of insurability, or anything up to a maximum of $500,000. So life insurance, open enrollment for ORP and MCRP, it's an opportunity to make some increases if that's what you're wanting to do without that additional evidence of insurability. Now, for everyone, we encourage you, review your beneficiaries, right? So if you're covered under VRS, you want to go through your My VRS account. to take a look at your life insurance, take a look at your beneficiaries. If you want to make changes, you can request that. At a very minimum, take a look at your beneficiaries, make sure that that aligns with what you want to do. And then same thing for optional retirement plan and medical center retirement plan. You can update your beneficiaries, view them and update them through your Workday account. And we encourage you to do that. Open enrollment is just a great time. Take a few minutes, take a look at everything, make sure everything is like you want it. And then, you're good to go for now. So another benefit that we offer to employees and spouses covered under the UVA Health Plan is the Who's Well program that provides financial rewards for certain activities. So for example, if you were to complete a personal health assessment, you would get a $100 financial reward. So, here's a way to earn up to $500 for doing things that, will help encourage a healthy lifestyle. The financial reward is paid on your paycheck. It's paid on a quarterly basis, and it is subject to taxes. So a couple of important dates we wanted to point out is any activities that you've done for this year. You want to make sure that you have reported those and done those things through November 30th in order to get your reward. And then the program starts again February of 2025. So the Who's Well program, the portal, is currently through a company called Virgin Pulse. And Virgin Pulse is going to be changing their name to Personify Health, which is exciting. So the portal and the programming and the user experience, that's all going to remain the same. It's just a change in name to Personify Health. And another change that's coming is in February of 2025. You'll be able to earn rewards for person-to-person support with a Personify Health coach. So you can earn up to $25 for each completed coaching session, and you can be rewarded up to 6 sessions during the time period of February 1st through November 30th. So we wanted to make sure that you were aware of that. And then, of course, again, you have an opportunity to earn up to $500 for pursuing activities that could, improve your health. And so, have some, improvements, earn some rewards. It's a win-win. All right, we are almost to the end. I appreciate your attention. I know it's a lot of information, but we're going to talk about some action items now. So the first thing to point out as a reminder, please make sure that you re-elect your FSA. That is not going to roll over into 2025. So if you want an FSA, whether it's full healthcare, limited health, or limited FSA, or the dependent care, you want to make sure that you re-elect that for 2025. Just a reminder, again, if you're going to be adding dependents, you want to make sure that you upload documentation. And here's the thing, even if that dependent is already covered under another option. So for example, let's say that you have the dependent covered under dental. If you add that dependent to your medical for this year, you're going to be asked for that documentation. So go ahead and just get it ready, upload it to the device that you're going to use to do your open enrollment. That way it's ready to go, upload it, submit it. So you want to make sure that after you've completed your open enrollment and submitted it, make sure you hit that submit button. Go ahead and print off confirmation. So, we really encourage you to do this. Have a printed confirmation to show the elections that you've made. And you want to make sure that you review it very carefully. Make sure that everything looks right. Make sure you have the right FSA, right? Make sure that you have the correct plan that you wanted, that the dependents that you want covered are listed there. Just review everything. Take a few minutes just to make sure everything looks right for 2025. So if you have a full healthcare FSA, make sure you use those funds. If you are let's talk about that too under number 5. So if you are actually, let's go back to number 4. My apologies. If you currently have an FSA and a full care FSA, and you're moving over to the health savings plan for 2025, you want to make sure that you spend down all of those FSA dollars by December 31st in order for your HSA account to be open. So let's repeat that to make sure it's understood. If you are now in a full healthcare FSA and you are moving to the health savings option for 2025 with the HSA, you want to make sure that you spend down your FSA monies by December 31st. It doesn't matter if it's, 3 cents left in there. If there's any money left in that FSA account by December 31st, then there's going to be a delay in opening your HSA. If you have any questions about that, feel free to reach out to Ask HR, and we can walk you through that if that applies to you. So number 5 is just repeating. If you are newly opening the HSA for 2025, meaning that you are electing the health savings account, make sure that you're looking out for any communication from Fidelity as far as your account being opened. And if Fidelity needs additional information from you, you want to make sure that you resolve that within 90 days. If you don't, you are going to forfeit the employer contribution, and we don't want that, right? So again, any questions, please feel free to reach out about that. And then lastly, we are going to be issuing a benefits survey at the conclusion of open enrollment or after that ends. And so, this is an opportunity for you to give feedback about the UVA health plan and to help us know what your needs are and what your desires are moving forward. So open enrollment ends on October 18th. The survey is going to be opening on October 21st, and it's going to close on November 1st. So we encourage you to take time to participate in this and give us feedback. Okay, so a lot of information, and I know we're getting close to the ending time. We've still had some questions coming through through Q&A. If you want, maybe take a screenshot of this slide that just give you the email address and phone number for Ask HR. So we encourage you, if you have specific questions, reach out. We are setting up appointments one-on-one time with employees, so you can get that scheduled and we can work through your particular situation and address questions that you have. Kathleen, is there any questions that would be applicable to the group?
Not at the moment. I do want to say that, a lot of questions came through and I was answering them very quickly. So if I didn't fully answer your question or you have more detailed questions relating to what you asked, please contact us at askhr@virginia.edu and we'll be happy to get into more detail with you. But hopefully I answered the questions that you asked.
It's a lot of information, and I know it can feel kind of overwhelming. But just take some time to, at a minimum, take a look at what you currently have. Take a look at what's available, and the key thing is October 7th through the 18th. Make changes if you want to, and print off your confirmation. Take a look at it. Does it accurately reflect what you intended to do? That's one of the key things. And, if there's a plan that you're uncertain about or want to get some, feedback, just as Kathleen suggested, reach out to Ask HR and we can certainly address those questions for you. Okay. Well, we really appreciate you attending today's session. I know it's a lot of information, but hopefully we've given you some information to help you in your decision making, maybe pointed out some things that maybe you weren't aware of. So hopefully this has been informative and helpful to you. We hope you have a good rest of the day.